Going live, and one last little thing to do here. Okay. Okay, Chair, you can take it away. Going live.
Well, all right. Thank you, Casey. This is the Wednesday morning, 10 a.m. regular meeting of the Lincoln County Board of Commissioners. This will be the new time and day of the week that we will be meeting routinely. And if we have some technical difficulties this morning, I apologize and appreciate your patience. It is 10:04 and I will call the meeting to order. We have all three of the commissioners present. Commissioner Jacobson, I believe, is present, but is not able to connect with video, but she is present. So all three commissioners are present and constitutes quorum.
Hey,
Moving on, the next.
Commissioner.
Oh, there you are.
Hey, can you hear me okay?
Yes.
Okay, great. I'm on a new phone in my car parked on the side of the road. So I just want to do a sound check, and I believe I have my video on, but I guess Casey can let me know if I don't. You
do.
Great. Okay, thank you.
So you are not only here audio, but you are here video. Okay, again, we have all three commissioners present, which is a quorum. We'll move on. Our next item on the agenda would be adoption of the consent calendar. These are items of a routine nature or items that have come before the Board of Commissioners previously. If commissioners or staff wish to highlight an item, they may do so now. Otherwise, I will entertain a motion to adopt the consent calendar as presented.
Mr. Chair, I'd move that we adopt the consent calendar as presented.
And I will second that motion.
It's been moved and seconded. All those in favor say aye. Aye.
Aye.
Aye.
That motion is adopted. Next item on our agenda is a public hearing. This is regarding a petition to vacate portions of streets within the Seal Rock View. And I will turn this over to Public Works Director Roy Kenyon and I believe County Counsel Jerry Herbage.
Good morning, commissioners. Can you hear me?
Loud and clear.
Very good. So yes, we have received a petition. When I say we, the county, Lincoln County has received a petition to vacate portions of Northwest North, Wallace, and Bernard Streets in Seal Rock View subdivision. Seal Rock View is located east of Highway 101, south of Ona Beach, and north of Seal Rock. So it's tucked in between in that area. The petitioners give as reason for their requesting this vacation that these properties border Brian Booth.
And you've frozen for me. I don't know for others.
Can you still hear me?
Yeah, I can hear him.
Okay. These properties border Brian Booth State Park. Wallace and North Streets have been a problem corridor for crime between the neighborhood and the park. Although there is a fence between the park and the right-of-way, this fence can easily be breached by going over or under the fence. As it stands, neither the homeowner nor the sheriff's department can do anything if individuals or groups access Wallace or North Streets or Bernard Street. Now, what they're saying there is these are public right-of-ways that are open to the public. Now, granted, they're not actually open roads, you would think as a road. They're not physically open, but they are legal right-of-ways. And so there we go right there. This here shows in red.
Director, I'm going to interrupt you. I think I confused people. I thought you would just offer, kind of set the frame, but I believe, correct me, Council Herbage, I need to open the public hearing and then have a staff report. Is that correct?
Yeah, that's fine. Say that you're opening the public hearing and then take in the staff report and then allow the public to comment.
Yeah. Okay, that's my error. I apologize to all. The public hearing is open. Back to Director Kenyon.
All right, thank you very much. As you can see, the area described in the petition is marked in red. And this map is correct for me. So up is north, down is south, and to the right is east. The property that basically is undeveloped that you see on the east side and the north side of this proposed vacation is state parks property, Oregon Park and Recreation. As you can see, the narrow line between state park property and these private property owners is narrow. It's a 30-foot wide right-of-way, which would be considered a half-width right-of-way. The reasoning for that is back in 1887, when this subdivision plat was put together, I believe there was an expectation that there would be another subdivision plat that butted up to this one on the east side and the north side. There would be then another 30 feet attached to the current 30 feet to give your standard 60-foot width. Now that never did happen. Back in the day, back in the late 1800s, this basically Seal Rock area was, they thought, destined to be the next vacation destination for the folks of Oregon, and there were big plans. Now that actually didn't come through. It didn't happen. So you have a 30-foot right of way that borders this subdivision. Could you scroll up one? There we go. This is actually looking north on Wallace Street, which would be the east border. You can see the fence that was put in by state parks. That's put in on the state park property right of way line. And you can see the vegetation. From what I can see, there probably has never been an actual improvement to this road. It's nothing more than just a legal right of way. So scroll up to the next, please. This is Bernard Street, which is, well, we're looking east on Bernard Street. It's a short section. The trees in the background basically are state park property. You have ownership on the left, and that belongs to it looks like Kevin and Rexanne Winters. And on the right, you can't see the residence, but there is actually one on the right hand side of this photo, and that belongs to Wesley and Tina Fritz. Now this here is also part of the vacation request. They share basically a common driveway within the right of way of Bernard Street, and they've asked to vacate that. These two photos here are looking north into the state park property. This one is at the end of Riggin Avenue, and the next one is at the end of West Street. And as you can see, there is no development of any roadway there. Basically, these public roads, as developed, end at what is proposed to be vacated. I have reviewed the petition submitted by Paul Ramola, and I have found that the petition is complete. There are 16 tax lots that abut and adjoin this vacation request. 4 of those are state park property, and the other 12 belong to the people that live within the Seal Rock View subdivision. I have signature sheets for 12 of the 16. So I have signature sheets for all 12 residents, all tax lots within the Seal Rock View development. I did not receive signature sheets from Oregon Park and Recreation. I did receive a letter from OPRD, Oregon Parks and Recreation, last Friday, and it was a letter of opposition to this proposed vacation. It is in, there it is, it's in the packet. Was also, public input, I guess that came in today, from Richard Hale, who lives within the Seal Rock subdivision, in favor of this vacation. That is, yeah, let's hold it right there. So anyway, like I said, we have a legitimate petition to vacate. The only thing that actually is holding this up is on Bernard Street. If that section, could you scroll back up to the aerial?
Yeah, Roy, just guide me as you need it and all.
Yeah, let's scroll back up to that right there. There we go. Okay, that kind of red rectangle in the middle where the arrow is pointing to right-of-way vacation. That is the end of Bernard Street. And in order for those people to basically have legal access to their properties, one of two things would have to happen. Either they would have to build their own driveways within that vacated section of right-of-way, or, which is more common, is they would give each other an access easement. So they would share an easement to their properties. That is actually in the works. They had submitted some documentation that showed where they was going to share maintenance. They had agreed to do so. It was asked by county council basically for an access agreement document that could be recorded by the county that would then be attached to the property deeds, and so it would be forever attached there. So we're waiting on that. That is in the works, and so I don't believe that we can really make a decision at this point until we have that document. I guess at this point in time, I would take any questions from the board.
Questions from commissioners?
Yeah, I do have a question. So if Casey can go back to that kind of aerial, oh, there it is, actually, it's up, sorry. That forested property that's kind of to the right of where the proposed vacation is that OPRD property?
Yes, it is.
Okay, that's the OPRD piece.
Well, actually, all of it is OPRD. So the property on the right that's forested and the property on the north end that's forested, that is all state park property.
Yeah, and I guess the second question I have is, and reading the packet that was provided to me and the information that was just put up, OPRB stated that they are or were initially at least supportive of the road vacation in their parks master plan, which was adopted, but then when they went to get a zone change, that was not done. And so now they don't support the road vacation. And I guess I'm just asking, do you have any additional kind of context around that? So do they want to wait until, the zone use is granted? And if so, are they going after that anytime soon?
I actually don't know. And
Okay.
I was actually going to suggest once Chair Hunt opens the public hearing portion of this, I was going to suggest that we leave the public hearing portion open and until, I'm hoping, September 15th, that we would then come back and take possibly additional information in, additional statements, and basically, and I'm also hoping that at that point in time, we will have a right-of-way or an access agreement between the two property owners on the east end there on Barnard Street, so that can be finalized, and hoping that we could all wrap it up on September 15th. So, but at this point in time, I do not have that information.
Okay, thank you. That's helpful. Thanks.
Commissioner Hall, questions, comments?
No questions at this time.
Okay, I have opened the public hearing and I will again look to Counselor Herbage, but I think in fairness, next steps would be to hear from the petitioners and then hear from any opposition. And then again, opportunities for questions. And then depending on the decision of the commissioners, we could continue this process to the date that Director Kenyon suggested. Counselor Herbage, any suggestions, corrections?
No, this is Assistant Counsel Herbage, and I agree with your approach. Let those who signed the petition go first. Those opposed also testify, and see what happens. But I would recommend that you do allow the continuance till September 15th.
Okay. With that, Casey, I'm going to need your help. I know I see Mr. Ramola. I believe he's a petitioner.
Yes, sir.
And I'll let you go first, and then I'll ask other petitioners to identify themselves. And Casey, if we need help with the technology, I appreciate that. But you're first, Mr. Renewal.
Can you hear me, I guess, is the $1 million question.
Yes.
Okay, I just wasn't sure.
That's fine.
I put together quite a packet discussing this issue and why we think it needs to be vacated. And also there was some issue about are we entitled to all 30 feet? And that's in the packet. And I really don't want, unless you want me to, I really don't want to rehash that. There's reasons for it and it's documented. What I would like to do is answer this minute Parks objection, if I may. And go ahead.
And go ahead.
As of, as far as I can see, the zoning area that was turned down is I turned the back 40, which is up Beaver Creek Road. As far as I can tell, their objection about the campground is moot because I don't think there's anything stopping them from putting the campground in. The only thing we objected to was that they wanted a massive amount of more land, and we felt that they couldn't even manage what they had. There was no fence up, and we got them to put the fence up. And so now there's a fence that divides us between the park and our property, or this right of way. And the fence is actually on their property, and they put it on their property on purpose because they didn't want to have to move it. A year ago or 2 years ago, Parks was okay with us vacating that property, and we have solid reasons why, and it's in the packet. They also agreed, and again, there's quotes in the packet. If you want, I can quote it. But Parks said that there would be no access from Seal Rock View into that park, and they kind of tried to back up on that, and we stopped it. And it's actually in the general plan that there'd be nobody coming from Seal Rock View into the park, and that's why we're trying to vacate Bernard. Also, is that street is no longer needed. The side that's on the park has never been platted, so therefore there's no road there. And that was one reason we could get all 30 feet, is that we were platted in 1890, whatever the year was, but we were platted, and the other side was not platted. It was just open land. And because it was open land, and because more than one person opened that land or held title to that land, we were entitled to it. And in my packet, in the first page, there was a Mr. Scott Branfield and Mr. Ethan Nicely. I think that was the two, sent out an email discussing this very issue, and they're county employees as far as I can tell. And they basically recommended that we get all 30 feet. There's a county road park that's right. It's a I called it an old logging road, but I think it was used for cable for utilities. And they've since improved that, and it goes the whole length of the park. And even if this road was needed, there's no reason to even have a road here because they have a road inside the park. And unfortunately, that road is used, and the park still is not looking in the park. They're not enforcing people coming in and out of the park. And we've had people actually, that road's pretty close to the fence, and they've actually jumped the fence and trespassed on people's property. People had to kick them off. And that's another reason I think this road, this right of way, needs to be enforced, because technically somebody could jump that fence, stand on it, and say, sanctuary, you can't touch me because I'm on county property. And the sheriffs have told us if somebody's on that road, they can't touch them. This road has nothing to do with the parks. And I think Mr. Hale's letter addressed that, although I haven't seen it yet. They stated something to the effect that they might need it later. Well, the master plan says otherwise. So I can't help but wonder what state is up to. I think part of this is because, can you still hear me?
Now we can again, yes.
Okay, sorry. I lost my video. I'll continue. The reason state parks is maybe doing this is because we oppose and help stop them from getting land in the back rezoned. And I just think this is just pressure put on us to shut up. And there's really no reason for it. And the other question I have to ask is, what are they up to, and are they going to try and change the master plan? That road is just a road that to nowhere, and we want it vacated so we can protect ourselves a little bit more. And there's a big packet that I submitted, and I hope
we have the packet.
I'm sure you'll go through it, and I don't want to rehash it. I think it makes a pretty good case. So with that, I guess I'm done.
Any questions from commissioners? Okay, seeing and hearing none, I believe Ms. Winters, are you a petitioner? Would you like to comment? All right, your mic is still off. There you go.
Okay, can you hear me?
We hear you.
Okay, so when we moved in, we built our house in 2017, we put the driveway in. And then Wes and Tina built their house, and they hooked onto the driveway as well. We are in agreement that we'll share that. We're in the middle of redoing our paperwork for that so that it can be submitted to the county. We've had a lot of issues with that back property line. Every once in a while, somebody would walk along that back fence. It'd be easy access to our house. So that's quite a concern of ours. We have cameras all the way around, but we can't keep an eye on it at all times. Other issues, the road between Tina and Wes and ourselves, that is an easement. We can't prevent anybody from driving up that road at this time, even though, it's intended as our driveway. It would certainly improve our safety, at least our feeling of safety, if that was vacated so that we had a little more control over that land. Additionally, we would also like to have that back easement vacated so that we could utilize that for wildfire abatement. So I'm not quite sure how that would look, but at this current time, our house is pretty close to the tree line. And last September, we had dry weather. It was pretty scary. So that's kind of where we're at. But we'll have our paperwork completed by the September 15th meeting. Thank you very much for listening.
Thank you. Questions from commissioners? Okay, I believe those are the only petitioners that are in attendance. Seeing no other individuals come forward, we'll
Chair Hunt,
go ahead, Mr. Miller.
it looks like I do have a hand raised from Wesley Fritz. Not sure if petitioner or not.
Well,
Want me to move
find
them?
out.
Yeah. Okay, Wesley, you should see an icon that's unmuting you.
Yep.
All
Yep.
right. We can hear
All
you.
right.
All right. Yeah, I'm one of the petitioners. So yeah, between the Winters and the Fritz family for the east portion of Bernard Street, we do have that paperwork in process.
Okay.
I was unaware that when we were first told with the paperwork that it was not accepted, I was out of town. I work on the road. So by limiting access to our quote unquote driveway, would definitely increase our feeling for security for, my wife and the Winters when, I'm out on the road for months at a time. And we have total agreement to maintain that together and work the aspects of it. So yes, and we've had more cases than not, especially during the summertime, of people walking up that roadway, looking into windows and all that. That's why the Winters ended up getting security cameras. And I've got a chain link fence around my house. But yeah, it's a security issue for us.
Yeah, I can't tell if you finished your comments or if we lost your audio.
No, that's it. That's all the comments I got.
Okay, I'm sorry. Okay, thank you. Mr. Miller, any other individuals who would be petitioners and wish to testify in favor of this?
Chair Hunt, I don't think so, but what I would ask our attendees to do if they do want to make comment and we're missing them, to use the raise hand function. That works pretty well. I do see a few names like Preston Phillips. Not sure if
He's OPRD, so he's next.
Okay. So yeah,
Once we're through with petitioners.
I think to me it looks like we've got through them. Yeah.
All right. If there are petitioners, please let Mr. Miller know. We'll now turn to opposition, and Mr. Phillips, I know you're with OPRD. Welcome and share your thoughts.
Okay, thank you. Good morning. Can everyone hear me okay as well?
Yes.
We'll make sure. Well, thanks for the time to speak. Being labeled as opposition is never a good thing. Pretty much where we're at is what I put in the letter was that it kind of caught us by surprise what we're up to. This was all the agreements of maybe that those would be something we could get rid of, the easements or the right of ways. Was something was going on during negotiations and planning for the development and the construction of that campground. The state park property has been there for quite a while. At this point, all the funding for that campground development, staff to do those developments, those are all gone. And so we really don't know at this time what the final disposition of this property is going to be. And so from the standpoint of more to the state, trying to make sure we don't just undermine the value of the land in the future. And again, I'm hearing and I know most of the petitioners have helped with the fence and such like that. So we know this doesn't come without some shock, but at this point in time, we're not in support of vacating those easements along.
Any questions from commissioners?
I do have a question. So you had brought up just now in your comment that, you don't want to devalue the land by putting in this easement. and I think we all understand that because of COVID, revenues first decrease and that sort of a thing. We also did not grant a zone change. I mean, is State Parks potentially looking at selling this property? Is that something that's sort of hanging out there? Is that why the comment around potentially devaluing it?
No, I don't believe it would be a selling thing, Commissioner. It'd just be a matter of, at this point, it's pretty unknown what'll end up happening there. Maybe it just sits like it is. Maybe we do eventually get some form of agreements with regards to putting the campground in there. I know you've spoken with some of my seniors in the agency of some other, potentials or thoughts, or we just don't know where we're at. And so whether it be the value or the flexibility of that open space, that public property, I think is more maybe the word I should use versus value.
So a follow-up question. So is this more of like a timing issue? Because in the master plan, this road is vacated, is my understanding. And so is this just more, if money and staff and all those things kind of weren't the option or weren't the issue, and this was moving forward, you guys would actually be in support of the vacation, but because those plans are up in the air right now, you're opposing it. Did I kind of summarize that correctly?
I believe the easements or the vacations were kind of part of the development. Obviously, if we'd put the campground in as we'd planned, and like Mr. Ramallah mentions, the road is pretty in there and offset of that piece of property. Again, if there's another use, and I don't know, what that would be, again, above my pay grade, and we're just trying to get our feet back on the ground. And so what we're going to do with this piece of property is definitely still like, it's not right on the tip of what we're getting ready to settle. We're just coming out of it. So for lack of a better way to explain it, no, we don't know what we're going to do with this property. Obviously there's still a call on the master plan. But then there's some zoning challenges there, and what that looks like. Again, maintain the flexibility and I guess the value of that property.
Okay, thank you. That's helpful.
Thank you, Commissioner.
Commissioner Hall, did I see you had a question?
Yes, but actually, it was very much along the lines of the questions that Commissioner Jacobson raised. So I don't have anything else at this point.
Okay. Any other comments from parties that are against this request? All right. I'll ask Assistant County Councilor Urbridge for guidance. Can I close the public hearing and then the board make a decision on whether we make a determination today or continue the hearing, or do I need to do that still in the public hearing?
I would recommend that you not close the public hearing, that you leave it open. I think that was the recommendation of Roy Kenyon.
Okay.
And I would recommend that the board make a motion if you're willing, because we know there's additional paperwork to come and probably additional testimony. If you would make a motion to continue this to your meeting on September 15th at 10 a.m. The advantage would be that we would not need to redo notice, and notice is comprehensive. There's 3 different types of notices that's done, which is very expensive. And so if we could have a continuance, we wouldn't have to renotice, and that would be very prudent.
All right, before we take that action, I'll ask my fellow commissioners, any last thoughts or comments?
Nope, I am in concurrence with the staff recommendation.
Okay, and I think the continuance is a good avenue at this time. I'm interested in certainly getting the paperwork that is still in process. I'm interested in maybe some dialogue between the county and OPRD to try to get a little better understanding of what their plans might be and how we might work together. And I think there's certainly plenty of material for the commissioners to review, and we may, after that, as we go through that process, develop more questions for staff. Any other comments, or I'll entertain a motion to continue the public hearing on the petition to vacate portions of streets within Seal Rock View to Wednesday, September 15th, 2021.
So moved.
Second.
All right, it's moved and seconded. Any other discussion?
And it will be at 10 a.m.
Okay, and the public hearing will be on Wednesday, September 15th at 10 a.m. Continuation of the public hearing. Any other comments? All those in favor, it's been moved and seconded. All those in favor say aye. Aye.
Aye.
Aye.
All right, we will continue this hearing on Wednesday, September 15th at 10 a.m. Thank you. And we will move on to the next item on our agenda, which is a resolution approving the Toledo Urban Renewal Plan. Council Herbage, I'll let you go first. And I see the City Administrator, Ms. Richner, is on the call also.
Thank you, Chair and Commissioners. This was on the agenda last week. The meeting was on the Monday of last week. We previously had actually materials that went with this, and it was made part of the packet. It described the areas, businesses to be benefited, and the board continued this matter to this date to make a final decision. It's in accordance with how the board generally does its business. It likes to receive information and make a decision generally in a following meeting. So that's what I have. Thank you.
Okay, any comments from others? I see Elaine Howard's on the call, Judy, of course. Questions or comments from commissioners? Again, this has been before us previously.
No questions from me, Commissioner Hunt.
Okay, well, I'll
Arson.
entertain a motion.
Mr. Chair, I move that we approve resolution number 21-18-9A, approving the Toledo Urban Renewal Plan.
I will second that motion.
Thank you. I was being patient. All right, it's been moved and seconded. Any other discussion? All those in favor say aye. Aye.
Aye.
Now that motion carries. Thank you.
You.
All right, next we'll move into reports, and I'm going to change the order just a little. I see Florence came on visually, but I think there'll be a lot of discussion about the COVID situation. So I'm going to move the Echo Mountain Complex grant report next, if that's acceptable to my fellow commissioners, and hear from the Executive Director of Northwest Oregon Works, Heather Dessart. Heather, welcome.
Thank you, Commissioner Hunt and Commissioner Jacobson and Commissioner Hall. First, I just want to say thank you for the grant that we were awarded back in October of 2020. We applied for the Echo Mountain Complex Fire grant from the county, and we were awarded $5,000. And we have expended those funds as of June 30th, 2021. And I just wanted to let you know a little bit about what those funds went towards. 20 individuals or families affected by the fire received $50 gas cards. 24 families affected by the fire were able to purchase groceries free of charge for it with this, using these funds from Kenny's IGA, which is a local grocery store here in Lincoln City, in the amount of between $75 and $300, depending on the family size. And then we also provided funding to cater a mental health retreat for those affected by the fire. I think Bethany Grace Howe helped with that. So that was the expenditure of the funds. They went directly to the survivors of the wildfire. I also just want to, since I am before you, take a minute to talk about some of our other funds that we have through the Department of Labor. We have disaster recovery funds that we were awarded for as a part of the COVID response, and we have 4 participants from Lincoln County, 2 placements with the Sheriff Department Emergency Management Division, 1 at Safe Families for Children, and 1 at your offices there, the County Commission office. We also have employment-related disaster dislocated worker funds, and 8 individuals from Lincoln County were being served with training in things like commercial driving, nursing, customer service, medical assisting, and animal care, and also received supportive services in the form of gas cards, books, fees for training and testing. And then finally, we did get separate individual DOL funds for the wildfire itself, and 19 participants have been served and enrolled to date. 7 are enrolled in temporary employment, and 1 is
automatic voice message system 5412.
Paul, you want to mute your microphone? Thank you. Go ahead.
Thanks. 5 are working at the Salmon River Grange, 1 at the Cascade Relief Team, and 1 for the Lincoln County School District, and 1 at Family Promise of Lincoln County. The rest of the wildfire impacted participants have received supportive services in the form of work clothes, transportation to enable them to participate in employment services. And we have a staff person with our subcontractor, Equus, who is going to the Grange every Tuesday and Thursday from noon to 3, and is going to the Coastal Phoenix Rising site on Mondays from 10 to 2. And that person is providing such things as assessment, eligibility determination, work readiness services such as resume writing, job search activities, and other services that are performed in the WorkSource Oregon system. So I just want to let you know that those funds are being deployed in Lincoln County nicely, and we are appreciative of all of the help that we've gotten from Lincoln County employees who are steering those wildfire survivors to the Kenny's IGA to be able to get those groceries and not have to worry about that when they're worrying about so many other issues. And that's all I have. Thank you.
Okay. Thank you. Questions or comments from commissioners?
Yeah, I do have a question. Thank you for being here, Heather. Really appreciate the update. I think maybe you're the only grantee we gave money to that actually formally came back and reported. So I appreciate that. I guess kind of switching subjects slightly, but while I have you, where are we currently with the federal workforce dollars that were available? I know you had to draw down to a certain percent before additional dollars were available. And for a while it was kind of a problem because all the money was committed, but it wasn't spent down yet to where more money could be accessed. So where are we with that currently?
So that's still the case. However, the state is working with the local boards that did receive wildfire funds. I guess the Rogue Workforce Partnership down in Josephine and Jackson counties received a large tranche of money, and the other boards around the state are experiencing the same kind of slow to spend situation that we are. And so we're working something out where we can borrow from the Rogue Workforce Partnership so that we can get, as a state, spent down to 70%, and then get replenished with the additional dollars that we were awarded but don't have yet. Does that help?
So, yeah, so still kind of a work in progress.
Yeah, well, there's
like,
there's a meeting on Friday that we're meeting quarterly to talk about it. There's a master spreadsheet that's being floated to all of the boards and the state so that everybody's sort of on the same page about who needs funds, who's doing okay, who's willing to wait for the second amount to come down from DOL. So it is being addressed, and we will have the funds that we need to continue on with these services.
Great, thank you. Because I will say there also is kind of a number of needs that are in a holding pattern right now, waiting for more of that money to be accessible. I mean, so I think there's some other needs at the county and with partners that we know of, but you know, we're just aren't able to move forward with those. So if you could just keep me updated, I guess after that meeting, I'd appreciate it. Thanks.
I will. And Commissioner, if you can help me know what those needs are, it'll be better if I have that information to articulate in these kinds of meetings so that we can say, yes, we do have stuff on the table right now that we need funding for. So maybe you and I can talk offline, or
sure, I'll send you a message.
Okay, perfect. Thank you.
Thanks, Heather.
You bet. Thank you for having me today.
Well, that answers my question. I was going to ask, what can we do to help get these funds to those who need them more quickly? So I appreciate that information. Any other questions or comments for Heather? All right, again, Heather, I thank you for the update as far as that grant. I was also back up a little bit and say that now was a critical part of the distribution of funds in December, where we virtually had about a month to distribute money to businesses, and you and your staff were a critical part of getting that money distributed prior to the year-end deadline. And I use that as an example of bureaucracy can move fast, and you were a part of that. So my thanks to you for that.
Thank you. It's our pleasure to help.
All right, and I'm going to work back up the agenda. Sorry, Florence, but we do have other people from outside the county that are here to talk about the Echo Mountain Fire update. And I guess turn it over to Commissioner Jacobson. Do you have some introductory remarks, or who would like to go first?
Sure, I'll introduce. We have some guests today to kind of give us an Echo Mountain Fire update, at least from their perspective. So we have Anna Hurt, and I believe Beth Otto is also here. Anna has been working with us in kind of post-fire recovery work through FEMA. And she's about ready, unfortunately, to transition away from being our liaison, and we have someone else coming in. But I thought it would be a good time for her to talk about that part of FEMA and what it does and what she's been helping us with, and kind of pass over the reins to the new person coming in. So take it away.
All right, thank you. Ladies.
Good morning. Thanks for having us today. Just want to steal a couple of minutes, like Katie said, and talk a little bit about what we've been able to work with Commissioner Jacobson and some of your staff on. She specifically had mentioned that typically people see FEMA, I think, in communities very front facing right after a disaster, and it's usually our individual assistance teams. And those are the people that work with individual homeowners or individuals in communities to kind of get some of the immediate assistance out the door. But what Beth and I do is a little bit different in that we work on the community planning and capacity building section of FEMA. And that section is designed to support units of local government, local leaders, staff, really thinking more about the long term. We actually don't usually show up on the ground till several months after a disaster happens, and we're there for a while. And the goal is to really be a thought partner and brainstorm with leadership or elected officials on the day-to-day operations and how they overlay with recovery work and what's going on in the recovery, and think through how those things need to be intersecting so that you guys can get, kind of the most success and leverage out of what's going on. So over the past few months, we've been working a lot on just thinking through what grants are available from different government agencies, not just FEMA, but other federal agencies. That's a big part of what Beth and I are kind of charged with, is bringing in, when needed, other federal agencies that might be able to help as well. Thinking about projects and how to prioritize them, looking for technical assistance resources, and supporting staff through some of those processes. And then the last thing that I think we've been kind of talking about over the last couple of weeks is doing a little bit of a framework session with stakeholders throughout the county and some key staff on the things that you already have going on. So you guys already have within the county, there's a lot of different projects in really essential areas like infrastructure, housing, economic development, and recovery, to include the Otis Echo Mountain area. And so looking at all of those projects and bringing them together in a framework that's going to kind of springboard you into the next, 5 to 10 years, and working with, Lincoln City, but also county stakeholders and other entities within the county to kind of build that out. And ideally that will leverage other funding resources. It can be a good tool to have as you apply for other federal resources as well. And so that's kind of our last piece that we've been working on together. And Beth is with me today. She's the regional community planning coordinator. So she's not going anywhere. She belongs to Seattle, and she'll be Oregon's in her area. And then there's another colleague of mine called Heidi Arnold, and she'll be working on especially that framework and planning piece for the next couple of months. Beth, do you have anything that you want to add that I missed?
No, I think that was very well put. We're happy to be here.
Thank you. Questions or comments from commissioners?
Well, I just wanted to say a big thank you to Anna as she gets ready to, leave working with us. Been really a pleasure, Anna. And I will just share that one of the first things she said to me when we met in person for the first time with a big smile on her face, she said, well, how's everybody doing? I've worked a lot of disasters, and I know that local governments 6, 7, 8 months after have a really hard time. It's stressful, it's hard. And boy, that was super validating. So thank you for that, Anna. You'll be missed, and we look forward to working with Heidi and others.
Yep, it's been great working with all of you, and you guys really are doing the hard work. This is hard work, and it goes on for a really long time after all the other pieces will fold up, long after we're out of here, right? It starts local and it ends local. So you guys really do the hard work. So thanks so much.
Commissioner Hall?
No questions, just appreciate the report and appreciate the great partnership that we've got going to move forward with this important work.
And I would certainly echo those comments. I think in many ways, the work that FEMA does on the ground isn't necessarily visible to everyone. Certainly, there are some examples that are highly visible, such as the housing project, but appreciate the hard work of everyone from FEMA. It's an important partner in our efforts, as you said, Anna, we start local and we'll end local, but you and your partners are a critical part of our efforts. And last thing I'm going to say is my mom's a retiree from FEMA. So FEMA is a little closer to my heart, maybe, than some other government organizations. But again, thank you both for taking the time to share that update, and we appreciate your hard work.
Thanks for having us.
All right. Finally, Florence, word to you. I appreciate your patience. I just felt that there probably will be a lot to discuss about vaccinations and what's going on in the county and the state. So I wanted to give you adequate time. And again, thank you for your patience.
Yeah, no problem. Good morning, commissioners and everybody. Yeah, it's a long presentation today, so bear with me. And it's, it's not necessarily very uplifting.
It's what is, and we need to face that reality.
Exactly. All right. So as usual, I like to present kind of like the bigger picture and then narrow down to what's going on locally. So as you can see, so this is the Oregon epi curve that was pulled as of, I believe, this yesterday morning.
Yep.
And as you can see, I mean, I don't know what happened for a few days where we saw kind of like a dramatic decrease in cases reported to us. But as you can see, as of yesterday, we had almost 3,000 cases reported overall for Oregon. Next slide, please. Okay, so this is kind of showing you still what is the variant of what variant is the most prevalent in Oregon. And as you can see, the Delta variant is still well, pretty much.
So Florence, if
yes.
I may,
Yes.
what are the characteristic difference between the two Delta variants?
This is a very good question. I can find information for you about this. What I can tell you about the Delta variants in general is that they are more contagious than the previous variants, and that they are like about 3 times more contagious than their predecessors. And this is why we're seeing such I have a French word coming up, a widespread of the flambé is what I wanted to say. That's not going to help anybody.
I might help some, but I didn't take French.
All right, next slide, please. But if you're interested, I can definitely look into those subvariant of Delta and get back to you.
The reason I ask is I think and I'm not a scientist, but I think anecdotally, as the virus mutates, it seems to be getting badder, for lack of a better word. And so I have a concern that as the virus continues to mutate and we deal with new variants, that it's going to continue to have a more severe impact on those that catch the virus. And if I remember correctly, we have seen some deaths in younger individuals and even, I believe, teenagers. So that's why I asked the question. My fear is that as the virus continues to change, it will become more, frankly, lethal.
Right. And as you, those are very solid points, Commissioner Hunt. As you may remember, when the Delta variants first emerged out of India, actually, there was not only one Delta variant, but a few different ones, and across the country, and it was more of a regional type variant development. I will definitely echo your concern as to this COVID virus being so good at adapting to its environment and being so good at transforming so that it can better, replicate and therefore, create disease. So I think, and we're going to talk about this later, but really what people need to remember or realize is that in order for us to stop those mutations and transformations, we have to vaccinate even more people and ensure that we are preventing the spread of this virus by also masking when we're indoors and around other people.
Okay, thank you.
Next slide, please. All right, so those also are as of yesterday morning. So this is the COVID-19 hospitalization rates throughout Oregon. And as you can see, the increase is pretty steep at this time. There are, I believe, I have a slide about this, but as of yesterday, we had 838 people hospitalized with COVID-19 throughout the state. This is about 8 times more hospitalization of folks with COVID-19 than we had 6 weeks ago. So it's really showing how this virus and this particular variant is really good at spreading fast and especially spreading mostly into the unvaccinated populations and getting to more people who are not vaccinated being hospitalized with severe iteration of the disease. Next slide, please. Okay, so this is just a slide that OHSU put out yesterday, and this represents only the number of patients who were hospitalized within their hospital system, right? And so this morning, we had a meeting with rural local health authorities and a representative from OHSU, and we had a very interesting conversation because OHSU is one of those hospitals, like kind of like top tier hospitals. And so pretty much the patients they are seeing are the patients who have really like severe severe disease and really real complications. And so out of those 29 patients that were hospitalized yesterday, 93% of the people in there were not vaccinated. And this is really clear, and you can see it throughout the country, you can see it throughout the state. Most of the people who are hospitalized at this time have not been vaccinated or have not been fully vaccinated yet. So I thought that would be an interesting slide to share with you, just to provide some perspective as to those folks who are really being hit hard with severe disease are mostly unvaccinated.
May I ask a question about that?
Yeah.
And I dug through the OHA website a couple of days ago to try to find this, and I couldn't, but I thought maybe you would know. Of this, fully vaccinated people, which of course is very low comparably to those that are unvaccinated and in the hospital, is there any data on what vaccine they were vaccinated with on the fully vaccinated people that are seeing hospitalizations?
So the data is there. Has it been pooled and analyzed?
Yeah,
I don't
maybe
know,
not.
because
Okay.
because the system, both at the healthcare level and local level and state level, is pretty overwhelmed with the surge. But yes, the data is there, and if there was capacity to pull it, we could pull it, but it hasn't been done.
Okay, I will check in with OHA about this. I do think it would be helpful for the public to know that, because if there is certain vaccines that seem to be doing a better job, and I've kind of heard that anecdotally that there is, I think it's helpful for the public to know that.
Yeah, I mean, what the public already has available for information is the efficacy of the vaccines we have available to us at this time, right? The 2 mRNA vaccine are have a very high efficacy. So those are the Pfizer and Moderna vaccines, efficacy of like 90+%. And we know that the Johnson & Johnson has an efficacy around 66%. So just looking at that, if you're wondering which one to get, I would suggest that folks go for the Moderna or the Pfizer vaccine if they can. Of course, those two will require 2 doses, while the Johnson & Johnson would require 1 dose. And we have more data available around those 2-dose vaccine at this time, in terms of how well they are doing, especially against the Delta variant. And so what the data shows is, at least for the Pfizer vaccine, the vaccine keeps its efficacy in the 90+% against severe disease, hospitalization, and death, while it loses a bit of its efficacy against infection. But what we know is that even vaccinated people who are infected are less likely to be hit with a severe case of the disease.
Thanks, Florence.
You're welcome. Next slide, please. Okay, so I was talking about that a little bit earlier. So this is kind of the picture at the statewide level as of yesterday. 838 people hospitalized with COVID. So like I mentioned, this is 8 times more than what we saw 6 weeks ago. Out of those 838 COVID patients, 222 were in the intensive care unit. And so just to put things in perspective, because that might or might not seem like a lot of people, but like the 838 patients are occupying 93% of the beds available. statewide. So that means there are only 7% of the beds left to be occupied. And the 222 patients in the ICU are occupying 90% of the ICU bed. So the Oregon Health and Science University has put out some projections and a forecast for Oregon as a whole, and it is grim looking because they are anticipating that Oregon will have more than 1,000 hospitalized COVID-19 patients by Labor Day, which is likely going to mean that we will be short 400 to 500 staffed hospital beds statewide. Next slide, please. Okay, so I thought I would, after the green picture, I would give some type of like, hey, what can we do to slow that pretty dire prediction? What can we do as an individual, and what can we do as a society, as a community? So the first thing, if you're not yet vaccinated and can be vaccinated, please go do that. Getting vaccinated is the best way we're gonna prevent the spread of the further spread of the disease, and also apology for the typo, how we will prevent the severity of the illness due to COVID, and how we're going to slow down the rates of hospitalization and death in our state. So getting vaccinated is the first thing to think about if you haven't done so yet. The second very important protection measures, and this is what we've been practicing for over a year now, is wearing a mask. And so I saw something yesterday that I thought was very interesting. Getting vaccination is almost like I'm taking this individual measure to protect myself, right, against this virus. I wear my mask to protect not only myself, but also the people around me. And all of a sudden, this is like me being conscientious and sensitive to the health of my fellow citizens and residents. So as you know, there is a mask mandate in indoor public settings in Oregon. And this is really very important and well proven. We have enough data to really show that when people wear their mask, we can, and consistently and well, remember, like we wear our mask over both our nose and mouth, and it needs to be fitted, and we don't need to take it on and off. We need to really wear it consistently when we're indoors, and that has been shown to really help reduce infection and spread of this disease. I'm adding something else. I know it's summer, we want to gather and be social. We are at a time and at a case rate per 100,000 that is through the roof in Lincoln County at this time. We're over 300 new cases per 100,000 over the past 7 days. So I would really encourage people to limit their social gatherings, maintain physical distancing like we've done for so long now. Remember the 6 feet distance when you are in public setting, and maybe reconsider this idea of being within a certain pod or a group of people to try to limit this, because what we're seeing is that we have a lot of different clusters of infections throughout because of this. This is a virus that spreads really, really quickly, and then people are still gathering, so that creates all those little pockets. So I'm going to repeat. 1, get vaccinated. 2, wear a mask in public. 3, limit your social gathering and maintain physical distance when you are in public. Next slide, please. Okay, so Lincoln County. Look at that. And we thought July was high. Look at where we are. We are what, August 18? The data was pulled as of so at the end of the day yesterday. 295 cases. And this, I want to say, is likely underreported, and I'm going to tell you why in a minute. First, I want to say at the rate we're going right now, we're likely going to be at least 4 times the total number of cases we had in July in August. That means we will be higher than the case count we had last June. Remember when we had our very large outbreak? We were at 305 cases for June. We're at 295 today. Second, we're going to be, of course, over the winter surge, where we had about 250 cases in December. This is concerning. As I mentioned earlier, our case rate per 100,000 is over 300 at this time. If you remember the previous kind of like metrics that we used to use to get a sense of, okay, how are we doing? Are we in a low risk, a medium risk? We are way beyond the extreme at this time. I don't think we've ever been at those numbers, to tell you the truth. And our test positivity is 18.7%. Let me discuss what the test positivity means. It means, let me grab my notes. It is the percentage of all coronavirus tests that have been performed. So this is in the last 7 days, right? So out of all of the tests that have been performed, this is the percentage of the tests that are returning positive. According to public health experts and the World Health Organizations, the rule of thumb is that one of the thresholds you want to look at is when it gets too high, it's when it's at 5%. So we're at 18.7. So, you know, I was reading an article earlier today that discussed that when you test positivity is, when you look at that and when it's getting higher than 5%, it indicates that it may be a good time to add restrictions to slow the spread of disease. Okay, so just putting it out there.
Can you restate that, Florence? I'm sorry, I didn't hear it.
Yes, so what I was saying is that, you know, the higher the percent positivity is, it suggests a higher transmission in the community, right? And there are also likely more people with COVID in the community who haven't tested yet. Okay, so that's that. And then the other piece is, it's usually a good indicator for policymaker or other folks to really think about, okay, so what are other measures we can put in place to slow the spread of the disease? Because right now it is spreading really, really fast.
You know, another way to state that 18.7% is it's roughly 1 person out of 5.
Exactly. Thank you. Yes, that is really good. It's a very good visual.
I have a question about that positivity rate. I remember, you know, previous in the pandemic where, you know, being open by state standards, we had to have a certain low positivity rate and that sort of a thing. And, you know, does that 5% kind of number, you said you were reading a scientific article about, is that take into effect or take into account rather, you know, the number of people you have vaccinated in your community? Because we're sitting at like 70-ish%. You know, there's still quite a few people that are not, unfortunately, but does that positivity rate take into account your vaccine rate?
I don't believe so.
Okay.
And something else came to mind. It went away. It might come back later. Oh, no, I know what I wanted to say is that I think that even that positivity rate might not be capturing all of the people who are actually positive in the community. And the reason for that is this, and I'm going to talk about it a little bit later too, is, as you know, there are a lot of, now there are some options to go to the store and grab a home test kit for COVID. And even though on the instruction, it says, if you come back with a positive result, please contact your local public health department so that we have the report of that case and can do all those contact tracing and investigation. And a lot of people are not calling us. So that means that we are likely underreporting on the number of positive cases. Next slide, please. Okay, so this is just, you know, us, our little local epi curve, and it's mirroring the state as usual fairly well. And as you can see, really, we picked up towards the end of July, and August is, I mean, we have a between like 25 to yesterday, I believe we had 42 cases reported to us in one day. So let me tell you, the team is busy, and they're trying their best to get through cases, but we're not able to get through the amount of cases being reported to us on a daily basis. Next slide, please. Okay, so this is also just looking at our hospitalization. So we wanted to show you, so out of the total cases, so this is looking at the period April 25th through August 14, we had 454 cases, 21 people, about 4.6% were hospitalized. And out of those 21 people, 5 of them were fully vaccinated. So that's about 20%. Next slide, please. Okay, so this is also to show you, like, from April to August, especially those last 2 bars. Look at that from week 1 to week 2 of the month of August, we saw a 70% increase in cases. And we will, it's going to keep going. And we had breakthroughs in about 26.5% of cases in July 1st. So that means that people who are fully vaccinated got infected with the virus. Still experiencing a disease that is way less severe than if they had not been vaccinated. Next slide, please. Okay, I thought I would show you this also, just to kind of look at who is getting hit. I don't know if you remember last year, really, when we were looking at age categories, our older populations were really severely, excuse me. Impacted by this virus. It has completely changed with this new variant. And as you can see, from April to August, 20-year-old, 30-year-old, 40-year-old are the ones who are most impacted. And the 0 to 19, we have plenty of cases too. Next slide, please. Okay, for August. So this is kind of what August is looking like at this particular point in time. So 295 cases as discussed earlier, 5 people in the hospital in August so far. Total cases this past week, 140. You know, we're seeing, so if you look at the graph, the blue columns are looking at the first week of the month. The orange one is looking at the second week, and the last one is looking at the data we have for the 16th. So caveat is that it is not the entire week for this past week, right? So we're kind of comparing apples to oranges. But if you look at the 2 first bars, you're seeing an elevation in cases in all age categories. Aside from, with the exception of the 70 and older. But then when you look at the younger age range, 0 to 19, their case count has doubled in a week. And we're not yet back in school. So this is why still, and I will repeat it again, those kiddos, especially the 0 to 11, do not have an opportunity to be vaccinated. You know, that action you can take as an individual to protect yourself. So this is where it is so important for everybody else, including those kids, to wear a mask so they can protect themselves and be protected from what other people around them might be able to transmit. I thought I would tell you where we've seen most of the cases this past week. So it's been Newport, Toledo, and Lincoln City. Next slide, please. Okay, so I'm gonna pause, see if you have any questions, and then I'm gonna discuss a little bit like what if people have some COVID-like symptoms.
Mr. Chair, it looks like you're talking, but you're muted.
Yeah, the dog got a little excited, so I muted to avoid that. Any questions from commissioners? I think at the end of this presentation, I would like to have a conversation about what we might do to be proactive in getting people vaccinated and to encourage people to wear face masks and social distance. But so I think we could have that conversation at the end. Any other questions or comments at this time?
I do have a couple of questions, Mr. Chair.
Go ahead.
First off, just these are things that members of the public have asked me, and I wanted to relay to you, Florence. What is the status of the potential for booster shots to being offered to people who have already had their 2 doses?
So I know there are conversations being held, but we're nowhere to being asked to provide those boosters. I want to put things a little bit in context, if I may, Commissioner Hall.
Sure.
So, as you may remember, earlier this year, it took a lot of effort and workforce and volunteers to be able to vaccinate 30,000 people in Lincoln County. If you look at the current context in terms of the hospitals getting full, the workforce being pulled, just from a logistical standpoint, if we were asked tomorrow to provide booster shots, I don't know how the system would be able to handle it, to tell you the truth. there is a lot of conversation globally outside of this country that if we really want to stop the spread of this virus and to stop this virus from mutating, we need to vaccinate people in other countries rather than providing a third shot to a few countries that happen to be pretty privileged, you know, and I think it's like 10 countries globally have been vaccinated over like, you know, 200 or something. Most countries have a very low vaccination rate at this point, 1-2%. And those are possible time bomb, right? And for new virus to, you know, I think this is where the conversation is some people are really going with, we absolutely need something here. And then others are saying, but if we don't take care of the problem globally, we won't necessarily be able to get out of there. That doesn't necessarily answer your question. I want a little bit, I wanted to add to this that we just had confirmation yesterday or the day before that, and we do not call those booster doses, those are called additional doses. We've received guidance from the CDC and the FDA and the Western work group for the Western states that people who are moderately to severely immunocompromised, and there is a very clear list of people and type of conditions that would fit that profile, could benefit from an additional dose of the vaccine because research has shown that for those people who have immunosuppressed system, maybe their body doesn't react well or not enough to 2 doses, or a third dose is more protective to them.
Thank you for that information and the context. One other question I've heard from a few people that they follow these weekly updates and also the daily reports on the public health Facebook page, but said it seems like it's been a long time since specific site outbreaks were reported, and they were wondering if there was a reason for that.
Yes, this is a very good question. So yes, there is a reason for that. The reason is because we're hit with so many cases being reported to us, we have to move into what's called a surge mode, where we are focusing on very specific questions, and also the outbreaks we're opening are more of the outbreaks where the risk of transmission and spreading of the disease are higher. So we're usually focusing on congregate settings like a long-term care facility, a jail or prison. Those type of facilities, we will definitely work the outbreaks, but it takes so much time and energy to do this. So what the team is doing though, is that when we see too many cases, let's say in a workplace or something like this, we are opening those outbreaks. So people not seeing outbreaks being reported on a weekly basis, this does not mean that we do not have outbreaks in Lincoln County. It just means that we have to pick our battles and prioritize.
Thank you. Those are the only questions I had at this point, Mr. Chair.
Commissioner
Commissioner
Hall,
Jacobson.
yeah, I just wanted to add to Commissioner Hall's question. I think I maybe had that same person or person with the same question email me this week, and the state still does report that. So there's a report that's put out every week on the OHA website that does give what they call weekly, it's called a weekly outbreak report for the state of Oregon. You can scroll through, so they have kind of divided up by types of facilities, like, assisted living versus restaurants or whatever. So that data still is available at a state level, including outbreaks we have here in Lincoln County. So it is still available.
Right. So what I'm going to add to this is that the state only reports what we are inputting in the system, right? So if we're not opening outbreaks, the state is not going to report the outbreaks. So the few outbreaks we've inputted in the systems are going to be open. The state is just not doing that legwork, if I may.
Yeah, understood.
Okay.
Any other questions?
And I think we're back to you, Florence.
Okay, yeah, please, no, go back where you were on the slide desk. Thank you. So I just wanted to discuss this. On Friday, we sent out a press release. I don't know how well it got distributed, but I just want to make sure that people know what to do in case they're coming up with COVID symptoms. And the reason for that is, like I said earlier, the team is working as fast as they can, but because we're getting more cases than we can work, we're getting a little bit behind. So if you test positive for COVID-19, please isolate from others. Don't go anywhere, please stay home, isolate, run the course of this for at least 10 days. Since you're either onset of symptoms or positive result. We will reach out to you as soon as possible. Okay, so now I want to especially discuss the at-home kits. If you got tested with at-home kits from a store and you get a positive result, please call us at the public health department. I put the phone number out there so that we can call you, see how you're doing, get a sense of who your contacts are. It's important for us to know you're out there and that you're getting help. If you need any type of wraparound services, we have all those resources available to you, but we can only know that you need them if you tell us that you do. So now, if you're a contact of a case, so meaning you've been exposed to somebody who is a positive COVID test, here's what we need to do. If you're not vaccinated or if you're not fully vaccinated, we need you to quarantine, meaning please stay home as soon as you can and monitor for COVID symptoms and stay away from people. If you're vaccinated, if you want to quarantine, you're welcome to do that, but you don't have to. If you decide not to quarantine, we're asking that you wear a mask for 14 days and that you monitor for symptoms. And if you need to get tested, there are plenty of resources available on our website. And as of yesterday, I believe Samaritan has reopened their testing operations in Newport at their community health education building. At this time, they're open from 12 to 4 p.m. Next week, I believe they will, or at the end of the month, they're going to be reopening for the full day, 9 to 5, Monday through Friday. And they're also working on opening a testing center in North Lincoln County. So we're working on all of that. And we've put all the testing resources available at this particular time on our website. It's on the front page. Next slide, please. Okay, so as we discussed a little bit earlier, we've had some news on the vaccine front this past week. So we discussed the additional dose for individuals who are immunocompromised. This was approved on Friday and Monday for Oregon. It's been interesting because when you look at the data and the number of people who are vaccinating at all our little mobile clinics, we can see a slight uptick in vaccination, but still, when you look at the overall graph, it's not enough to really show an increase. So we're still pretty much at a plateau when it comes to vaccination. We still do not have a vaccine available for children under 12 yet. The anticipation is that it's going to come either fall or winter 2021, 2022. And as discussed earlier, there are no booster doses recommended at this time for anyone. Next slide, please. Okay, so this is kind of like the plateau that I was talking to you about. So we did so well and this spring, and then really we're down to about between 0 and 50 vaccination a day in the county at this time. Next slide, please. We're still doing pretty amazing. You know, when you look at the overall vaccination rates in Oregon, we're like number 5 when I looked yesterday, which is tremendous. You know, 75% of eligible people vaccinated with at least 1 dose. Amazing. Still, if we can do better. The more people vaccinated, the better to slow this virus down. And we're still well aligned with the state numbers. So I think we're doing really good. Next slide, please. Okay, and then our usual kind of like vaccination by zip code. So we're still seeing, you know, some positive changes. Only the Tidewater area hasn't seen really a change from last week's number. Those on the left-hand side are all of the clinics targeted in Siletz, in Otis, in Toledo, and in Newport this month. And we are also continuing the outreach to our faith-based organization and churches, workplaces, and also all of the organizations that are serving our most marginalized community members. We also made sure that, for example, when the team investigating cases realizes, whoa, this workplace has a lot of cases right now. Would you guys be interested in vaccination events? Yes, okay, refer that to the vaccination team, who then outreach to that workplace to provide those vaccines. And you know, we're really operating out of a rapid operational model where we're not afraid to adapt the strategies based on what we're seeing and the reality we're facing. Next slide. Right, that's it for today.
Questions or comments from commissioners?
Yeah, I have a couple of questions, Florence. As far as, you know, vaccine incentives, we did receive some dollars from the state for incentives to try to, you know, incentivize people to get vaccinated. You know, I know early on when those incentives were available, we were doing like gift cards and, you know, that sort of thing to businesses. I mean, what's the team's thought on kind of like sweetening the honey pot a little bit? Or do the incentives seem to be working? Would putting in some kind of lottery like other counties have done, would that, you know, help? I mean, what's the barriers at this point?
Yeah, so on the incentive front, I mean, this is a really good question, and we have now more data than we used to have, because plenty of places throughout the country and the state have, you know, sweetened the honey pot. And what we're seeing is that it hasn't really impacted the uptick in vaccination at all. So I reached out to my colleagues this morning, and some of them offered kind of their perspective. You know, and there was a publication in in a journal at the beginning of July that really showed very little difference in vaccine uptake when looking at incentives being provided versus incentives not being provided. Our colleagues in Douglas County, Coos County haven't seen any impact. We have, I do not remember what county this person is from, but she's telling us that they didn't see a big spike in vaccine uptake when they decided to offer additional lottery drawings. Same thing in Lane County. They haven't seen a lot of positive impact. In Lincoln County, what we've done since we've received that grant, or those grants, may I say, is that we've offered a $25 gift card to people and try to make it so that it would really kind of fit either the location or like make it very local, or culturally relevant to people. But the team was telling me recently that people are even surprised, even though like the incentives are advertised on the flyers and on all the communications we're doing, people are really not expecting the gift card, So
I guess
based on all of that, and I don't know, in my mind, I don't think if we're basing our decision making out of the data and the experiences of other counties and what the research is telling us, that doesn't necessarily make a difference.
I guess my other thought is, when it comes to transportation, transportation is always a barrier in this community. People are all sort of rurally spread out. And when I see, Tidewater and certain communities like that, transportation is an issue for them. And I know we've, had conversations with Cinda from Transit, Lincoln County Transit, but, maybe it's time to start thinking about a vaccine Uber or something, of that measure where people could, call and kind of schedule a ride through our call center or something like that to actually get them. And might be worth, looking at some type of partnership with our local, cab companies or something of that effect.
Yeah. So glad that we're on the same page. We were having this conversation this morning with the team. They're going to reach out to existing cab companies and see what's possible. Just so you know, we do not have a call center at this time that is operational. We are staffing our phone with one staff member at this time. We've definitely seen a little uptick, but if this is the route we are, deciding to go in terms of helping people to schedule taxi rides and things like this, we will definitely need to staff up and then be able to possibly reuse the call center.
Anything else, Commissioner Jacobson?
Nothing for right now. Thank you.
Commissioner Hall?
Nothing for right now.
Okay, well, I think following up on, conversations that we've had, each of us have had with various people at various times, I'm interested in something that the county can do to try to incentivize or try to improve the vaccination rate, whether it's, and I tend to agree, if I remember correctly, even the $1 million lottery that the state had, the data really doesn't support that made any difference, any meaningful difference in the number of vaccinations. So, I'm not sure that the monetary aspect is the best way to go, but there might be some other ways, such as Commissioner Jacobson suggested, working with cab companies, and you mentioned it too, Florence. I know it's been discussed, working with other partners to provide transportation. I don't know about providing incentive to employers to allow their employees to get vaccinated on company time. Again, I'm just trying to think outside the box and say, what are some things that the county might do to try and improve the rate of vaccinations that we haven't tried? And I guess I would say maybe between now and our next meeting, you can have some conversations, and maybe there's some recommendation that we might be able to consider.
Yeah, I mean, we're happy to work on this.
And let me say, I recognize that, I recognize that the Health and Human Services staff, particularly the public health staff, all of our partners, they're exhausted. They're burnt out. And frankly, I think all of us to some degree have had more time devoted to the COVID than is reasonable. And it's been highly frustrating for all of us. So when I suggest or ask for some suggestions, I want to acknowledge up front that I know that people are burnt out, they're tired, they're exhausted, they're mentally fatigued, and that makes it all that more difficult. So having said that, if something can be done and some possible suggestions or something that we think might work, I'd be interested in at least having that conversation.
Yeah, we will be happy to have it.
Yeah, I would just add to what Commissioner Hunt just said. My next comment was going to be, besides being worried about the community and really not wanting us to be in a position like some of our Southern Oregon counties are currently in right now, I'm also very worried about our staff and, specifically public health staff and you specifically as well, Florence. I just want to, reach through the phone and give you a hug right now. But, I guess I also want to be hearing, what can we do for our own staff, because we are not through this yet, as you know. And we're probably not going to be through this for a while, and we have to, maintain this somehow. And so, I know it's been asked, and it's like, well, it's really hard, but we can't really think of anything. Well, I think it's time to think of something. Can we get in the queue, at OHA for them to come relieve all of you for a week? They've done that with other counties. They've offered it in the past. Now might not be the best timing, but maybe if we put in the order, for 4 weeks out or 6 weeks out, they'd be able to do that. Is there something else that can help those people take a break and to relieve some stress? I think we want to. I am not currently satisfied with the answer, that nothing can be done. I think that something has to be done to help all of you.
I agree. To us reaching the state, we have, and they helped us quite a bit, like last week and a few days of the week prior to that. And then they got hit really, really bad with everybody across the state asking for support. And of course, like we were here, they arrived at capacity and had to make decisions on what would be the criteria for them to be able to support counties. And so they are unable to support us anymore for case investigations. However, they've been really good, and they've dedicated 3 contact tracers to help us with the contact tracing needs. We've also been working hard at recruiting more people. We've been lucky to have had applications from folks who had done some COVID investigation work or contact tracing work with other agencies. And still, it takes time to recruit, it takes time to train, and it's also draining in a way because you have to integrate new people, rediscuss the processes. I mean, that takes a toll on the team as well. So, if we want to talk offline as to what could be done for the team, I think that would be wonderful.
Sure.
I appreciate you acknowledging the fatigue. I think at this time we are chronically fatigued, chronically stressed. Some of our team members are re-traumatized, to tell you the truth. And especially with that particular surge, I think no one was really expecting it to hit us so hard. So, and really what I'm telling them daily is that we cannot do it all. You have to do what you can. And this is why we're doing this communication about, hey, if you had a positive test and you didn't hear from us yet, please take those steps, right? So that you're helping us, you're helping protecting your community. And we will get to you when we are able. And please be nice to us when we talk to you. And if you don't want to talk to us, it's fine. Please do not yell at us. We're just doing our job. And this is aggravating for a team that is already tired and stressed out, to tell you the truth.
Well, let's talk more offline. Thanks, Florence.
You're welcome.
Commissioner Hall, any last comments?
No, I would just say again, I want to acknowledge as well the stress the team is under with this fourth surge and the worst surge yet. And I'm certainly supportive of doing anything we can do to ease the burden for them to some degree.
Yeah, I might add, Florence, when I was saying, challenging the group to come up with something that might improve our vaccination rate, maybe I should say that's the second item. Number one would be come up with something that we can do to help the staff, something that we can do that will make them understand that we truly do appreciate their hard work and truly do understand that they're burnt out. And I know that Director Romero is participating in this calls, and I know the two of you will work together and let us know what we can do to help staff. I have had conversations with the Director of Personnel, and clearly there's some things we can't do to expedite the hiring of people, and one of the things we can't do is get people to apply that are qualified. But I know that the personnel department is certainly willing to work to try to expedite the hiring of people when it's appropriate. So again, I don't know that there are enough words to acknowledge the hard work and dedication of the public health department, the staff, and partners throughout the county. So please know and please share the fact that we all appreciate their hard work. Anything else? All right, Florence, thank you, and keep up the good work.
You're welcome. Have a good day.
Thank you. All right, we're down to commissioner reports. Commissioner Jacobson, you're at the top of my screen, so I'll give you the opportunity to go first.
Yeah, I just wanted to report a few things with regard to fire recovery. I'm actually, I'll switch my camera over. I'm actually sitting right now at the FEMA direct housing mission site over in Otis and over in North Lincoln City, rather. Just this morning did a tour with Senator Merkley in the Otis area to look at recovery work. And talk about some things that we still cannot find funding for, like repairing roads that are being severely damaged by the recovery process. So a nice, brief but nice visit with him on those items. I would also say that last week, maybe that was 2 weeks ago, I don't think we had a fire update last week. I had a tour with several people from the state over in Otis, including two of the housing development contractors the state has hired to work on housing developments for wildfire survivors. I was very impressed with the both of them. And they are actually actively looking for property in the Otis, Rose Lodge, Neotso area to purchase, try to create permanent wildfire survivor housing. So really happy, hopefully some of that can kind of get moving soon. The state has also ordered over 200 manufactured homes, and they don't know where those homes are going yet. That's for the whole state, but it's possible that we may be able to get some of those, as well as the state has intent to purchase all of the FEMA trailers when done. Additionally, the direct housing mission for FEMA only lasts for 18 months, and March 2022 is about when that is up. And the state is in process of working with the tribe who owns the land to actually request a formal extension through FEMA to extend that direct housing mission, which would provide an additional Band-Aid in terms of getting survivors to a more permanent place, just by more time to figure some stuff out. So that's kind of the fire update from my end. Thanks.
Okay. Thank you, Commissioner Hall.
Last Friday morning, I convened the first meeting of the Coastal Phoenix Rising Partnership. This was a group of about 20 stakeholders on the line. We were really impressed and pleased with the turnout, and the whole goal is to make sure there's a very strong partnership to support the long-term viability of the Project Turnkey Motel in Lincoln City, which is purchased by and being operated by Northwest Coastal Housing. We had elected officials and staff from the city of Lincoln City. Several county departments were represented, both the IHN CCO and Samaritan Health, nonprofit service providers, and many, many others. So, I think it's just strong testimony to how much that facility is needed and how important it's going to be in the long term for Lincoln City and North Lincoln County.
All right. Thank you for that. And I chuckled a little bit. I thought how appropriate Phoenix Rising is for that mission. That's, of course, Greek mythology about a bird that flew too close to the sun and turned to ashes, but revived out of the ashes. So a little mythology there. I have a very sad job. I am very sad. It grieves me to report that Commissioner Don Lindley passed away yesterday. Don is the longest serving commissioner in the history of our county. He served for 21 years, was elected in 1990, started serving the county in 1991, and served through June of 2012. I had the honor to be appointed to replace Commissioner Lindley on this board. And Don was a dear friend, a dear mentor, and I know that he was a mentor to so many people. And not only was he a mentor, but he was a true leader in building collaboration. Certainly the M team evolved under Don's leadership and broke down silos within our county. Don was instrumental in the realignment of Highway 20. I remember him telling me a story, or not a story, but telling me that he in fact got up one day at the crack of dawn, drove to La Grande, Oregon to testify before the Oregon Transportation Commission about the need for the realignment of Highway 20, and then drove back because he had commitments that required him to be back in the county Don was also president of the Oregon Association of Oregon Counties, AOC. And one of his accomplishments there was certainly working with the legislature to get significant increases in funding for parks. And I think quite appropriately, our county has named a park after Don. It's on the Alsea River. And it's one that we continue to improve as funds become available. So again, it's with great sadness that I report that Commissioner Lindley passed away yesterday. And the flag, the courthouse flag, will be flown at half-staff in respect for Don and to honor Don and his great service to our county.
Mr. Chair,
Commissioner Hall,
could I offer a few thoughts about Don's passing?
please.
Yeah. It was really my privilege and honor to serve alongside Don for the last 8.5 years of his tenure. And of course, I spent a lot of time with him before I was elected a commissioner as a reporter covering county government. Neither of us may have realized it at the time, but in a way that was kind of like a master class preparing me for the day when I would take this office. And I think you've touched already on the fact that for Don, I think relationships were everything. Relationships are the basis of how we get things done, not only individual relationships, but institutional relationships. That certainly the joint meetings that have now been going on for almost 30 years, I believe, involving our county commission and the 7 city councils in the county, as well as the Confederated Tribes of Siletz. That is another legacy of Don's. And he's going to be missed by a lot of people, not only for his skill, his passionate commitment to serving the people, but also his gentle good humor as well.
Thank you for that. All right, we'll move on to public comment. Casey, show us the public comment we've got, and then we will be trying to incorporate public comment virtually through this meeting. And Casey, maybe you can kind of give us and give people that may be watching a dry run as to how the opportunity to comment publicly before the board virtually may occur starting at our next meeting.
All right, Chair, stand by. I'm going to a screen share here of county's website. This is our smart sheet, and what we would see here is the constituent received for the general commissioners meeting and possibly short-term rental. It's really the form we prefer people submit information to us. They can make attachments and do complete letters. It's very flexible, but it looks like we've only got one item from Richard Hale recently. So that is what constituent input looks like right now for this meeting. Don't see any STR. Excited that going forward, we'll be able to integrate the community into the meetings. If folks go to the county commissioner's website here, they'll see the picture of the 3 of you, and there's a link to the smart sheet. And as well, just below this, it says, would you like to attend a public meeting virtually? And there's a link there, and that provides some details about attending the public meeting, how folks can register through Zoom. All that information is here. And then also our constituent input guidelines that you established in 2019. I mean, I think generally probably the same principles are there, even though it's virtual. This is what will be active for everyone going into next week. Any questions, or do you think that's sufficient information?
Well, I guess we'll ask a question. I know we received a couple of, well, there was an email that contained public input from Richard Dreyer and Richard Hale that was received just before this meeting. So previously, when we were meeting at 3 o'clock, we had a 1 p.m. deadline. I'm wondering if with a 10 a.m. Deadline that maybe public input that's submitted be recorded as of frankly, I guess the prior day, Tuesday, so that if we receive public input on Wednesday, it would be a part of the report in the following week, if that's agreeable to my commissioners. Okay, I'm seeing heads nodding. Or Katie?
Yeah, I agree. I have a question for Casey as well.
Yeah,
Okay,
just on that point, thank you. Yeah, we've got a really tight window from the time we kind of log into our computers Wednesday morning. So I think that works for us too, from a staff perspective. So thank you.
okay. So what about people that click or fill out the form on the link and want to appear virtually? Clearly, we need some time to get that organized. So what kind of a time deadline or time frame would work for you and our staff?
Oh, well, no, it's already there. So it's ready to go.
Okay.
Yep.
Katie, you had a question.
Yeah, actually a follow-up question to what you just asked. So people register, they attend the meeting, and then in the meeting, are they raising hands
Yeah.
to make public comment? Okay.
Yeah, good question. So generally, as individuals that aren't reporting today, for example, like Heather Desart, we had her on the agenda, but the general public will come in as what's called an attendee. And I think the general expectation there is that we won't be asking them for their video. We're just looking for the audio. And for the public just to be aware that there is that section of our agenda that is constituent input. And I think what I might monitor for, and we can, experiment with this a little, is just for constituent input. They can raise their hand, and I want to say, when I was watching our petitioners today for the vacation, that it numbers the individuals in the order that they've raised their hand. I'm not totally certain of that, but that might be something that will help us kind of filter for, who wanted to appear first. Of course, we'll get to everyone. And I imagine, and help my memory here, were we doing about 3 minutes or 5 minutes for constituent input typically? Do you guys recall that?
3 minutes, I believe.
Okay.
Yeah.
So,
and just to clarify, when we're listening to comment in a public hearing, there is not a time limit.
Yeah.
Because that's a public hearing on a land use issue. But when it comes to constituent input, there is that 3 minute time limit. And we should maybe add that as a note on the agenda moving forward.
Okay, good idea.
Anything else, commissioners? Okay, again, thank you, Casey, for your efforts. And again, by this process, we hope to make it easier for public comment from individuals that wish to address any item of their interest before the Board of Commissioners for up to 3 minutes. And with that, our next meeting of the Lincoln County Board of Commissioners will be on Wednesday, Wednesday, August 25th at 10 a.m. and it will be held virtually. So until that time, have a good day and thank you all.